Gentlemen, today I want to talk about something most men don't realize they still have a great deal of control over. I'm talking about your vascular health, specifically how blood flow throughout your body affects male function in very real ways. What I'm going to show you can significantly improve circulation, including to the areas that matter most, in just a few minutes, using techniques you can do almost anywhere. Now, I know that may sound exaggerated at first, but the physiology behind what I'm about to explain is solid. When you understand how blood flow actually works and what quietly restricts it, you can use specific techniques to help reopen circulation pathways that may have been partially closed for years without obvious warning signs. The key is understanding this. Your blood vessels aren't rigid pipes. They're living, responsive tissues that constantly adjust based on signals from your nervous system, hormones, and the surrounding tissue environment. Inside your arteries is a layer of smooth muscle that constantly adjusts how wide or narrow your blood vessels are. When that muscle tightens, vessels narrow and blood flow is restricted. When it relaxes, vessels widen and blood flow increases, sometimes dramatically. Here's the issue most men don't realize. Many men over 40 are walking around with blood vessels that are chronically tightened, not enough to cause obvious medical problems, but enough to noticeably reduce function. And this shows up first in areas supplied by smaller blood vessels, especially the pelvic region. The encouraging part is this: that constriction isn't permanent damage. It's a functional state, and functional states can be changed. When you understand what signals tell blood vessels to relax, you can influence those signals far more quickly than most men expect. Let me explain what's happening underneath the surface. Inside your blood vessels is a thin inner lining called the endothelium. This layer plays a critical role in controlling circulation because it produces a molecule known as nitric oxide. Nitric oxide acts as a signal. When it's released, it tells the smooth muscle in your arterial walls to relax. As that muscle relaxes, blood vessels widen, a process known as vasodilation, and blood flow increases. More nitric oxide means better circulation. As men age, endothelial function naturally declines. Your blood vessels produce less nitric oxide, and they also become less responsive to the nitric oxide that is produced. This is one of the primary reasons blood flow and function decline over time. But here's the important part. Endothelial function is highly responsive to the right signals. It can improve quickly when those signals are applied correctly, and that's what makes the next part so encouraging. The 5-minute protocol I'm about to show you combines 3 mechanisms that enhance blood flow at the same time. First, we'll stimulate nitric oxide release directly. Second, we'll activate your parasympathetic nervous system, the system that tells blood vessels to relax. And third, we'll create controlled pressure changes that force vessels to open. When all 3 happen together, the effect is powerful and immediate. Let's start with the first component. The first part of the 5-minute protocol is a specific breathing pattern. This isn't general relaxation breathing. It's structured to maximize nitric oxide release and activate the parasympathetic nervous system. Here's how it works. You'll inhale slowly through your nose for 4 seconds. As you inhale, expand your belly first, then your chest. This diaphragmatic breathing is important because it stimulates the vagus nerve, the main nerve responsible for calming the nervous system and allowing blood vessels to relax. After the 4-second inhale, you'll hold your breath for 7 seconds. This brief hold creates a temporary drop in oxygen levels, which signals the body to widen blood vessels to improve delivery. Then you'll exhale slowly through your mouth for 8 seconds, letting the air release fully. This long exhale further activates the parasympathetic system and helps release tension, including tension in the smooth muscle of your blood vessels. Now here's the key detail most breathing exercises leave out. During the 7-second hold, gently hum. That humming creates vibrations in the nasal passages and sinuses, where a significant amount of nitric oxide is produced. Complete this full cycle. Inhale, hold with humming, and slow exhale 5 times in a row. This takes about 90 seconds and forms the foundation of the vascular reset. Now we move to the second component of the 5-minute protocol, which is isometric muscle contraction. Isometric contraction means tightening a muscle without moving the joint. When you contract a muscle this way, blood flow to that area is briefly reduced. And when you release the contraction, there's a reactive surge of blood flow that exceeds normal levels. This surge doesn't stay local. It creates a systemic increase in circulation, including to the pelvic region. The muscle groups we're going to use are chosen intentionally. They're large muscles, and activating them has a strong influence on pelvic blood flow. We'll work through 3 areas, one at a time. First, your glute muscles. Squeeze your buttocks together as firmly as you can, as if you're trying to hold something between them. Hold this maximum contraction for 15 seconds while breathing normally. It's important not to hold your breath here, as that changes the physiological response. After 15 seconds, release completely. Many men notice a warm, rushing sensation as blood flows back into the area. Next, move to your inner thighs. Press your knees together firmly, again creating a maximum contraction. Hold for 15 seconds, breathing normally throughout. Then release fully and allow the blood flow to return. Finally, contract your lower abdominal muscles. Gently pull your belly button toward your spine and tighten the lower abdomen. This also engages the pelvic floor muscles. Hold for 15 seconds, then release. This full sequence of 3 contractions takes about 90 seconds and creates a powerful increase in blood flow through the pelvis and lower body. Now we move to the third component of the 5-minute protocol. This part uses dynamic movement to create pressure changes in your abdomen and pelvis. These movements gently compress and release the blood vessels and internal tissues, mechanically encouraging blood flow while also stimulating the nerve pathways that regulate vascular tone. We'll go through 3 simple movements. The first is pelvic tilts. Stand with your feet about shoulder width apart and your knees slightly bent. Slowly tilt your pelvis forward, arching your lower back and allowing your buttocks to move slightly backward. Hold this position for 2 seconds. Then tilt your pelvis backward, gently tucking your buttocks under and flattening your lower back. Hold again for 2 seconds. Move smoothly back and forth like this, completing 10 full cycles. This creates rhythmic pressure changes in the pelvic region that help improve circulation. The second movement is hip circles. Place your hands on your hips and begin making slow, controlled circles with your pelvis. Imagine you're drawing a wide circle with your hips, moving smoothly and evenly. Complete 5 circles in one direction, then 5 in the opposite direction. This further increases pelvic blood flow and helps release tension in the hips and lower back, areas that can quietly restrict circulation. The final movement is deep squats. Lower yourself as if you're sitting into a chair, going only as deep as feels comfortable for you. You do not need to go all the way down. Hold the bottom position for 3 seconds, then stand back up. Complete 5 repetitions. Squatting briefly pushes blood out of the pelvic region, and when you stand again, fresh blood rushes back in. These 3 movements take about 90 seconds, bringing the total protocol time to just under 5 minutes. For the final 30 seconds of the protocol, we use something called vascular visualization. This may sound abstract at first, but there's solid research showing that focused mental imagery can influence real physiological processes, including blood flow. Studies using thermal imaging have shown that when people visualize warmth and circulation in a specific area, blood flow to that region can measurably increase. For the final 30 seconds, close your eyes. Picture warm, oxygen-rich blood moving freely through your body. Visualize your blood vessels as open, relaxed pathways, allowing circulation to move smoothly and easily. Focus especially on the pelvic region. Imagine warmth, fullness, and ease spreading through your lower body. This mental component may seem subtle, but it reinforces the physical techniques you've just completed and adds to the overall effect. Now let's talk about when and how often to use this 5-minute protocol. One of the advantages of this approach is that it works in 2 ways. You'll notice an increase in circulation and responsiveness right after you do it, but when practiced regularly, the benefits also build over time. If you're looking for an immediate effect, you can use this protocol about 15 to 30 minutes before you want optimal function. The vascular response often lasts for several hours. For longer-term improvement, I recommend doing this once daily, ideally in the morning. Over weeks, this helps train your blood vessels to stay more responsive even at rest. Many men notice early changes within the first 2 to 3 weeks. Warmer extremities, better energy, and improved responsiveness. And this is where I want to briefly connect something important. If you're the kind of man who prefers a clear system, not just a single technique, I've put together something that ties directly into what we're discussing here. It's called the All-in-One Men's Vitality and Intimacy Blueprint. Inside, I walk you through how circulation, hormones, sleep, nutrition, and daily habits all work together. Using the same principles I apply in my practice with men over 50. You'll find it linked in the description and pinned comment if you want to go deeper. No pressure, just a next step for those who like structure. Now, back to the protocol. You can safely do this more than once per day if you like. Some men use it in the morning and again in the evening. Others use it whenever they have a few private minutes. The key is consistency. Now let's talk about a few simple ways to amplify the effects of this protocol. These aren't required, but for some men, they noticeably increase the response. The first enhancement is temperature contrast. If you have access to a shower, alternating warm and cool water on the lower body can act as powerful vascular training. Warm water encourages blood vessels to relax. Cool water causes them to gently constrict. Switching between the two trains your blood vessels to become more responsive and adaptable. After completing the 5-minute protocol, you can spend about 2 minutes alternating between warm and cool water, roughly 30 seconds of each, directed toward the lower abdomen, thighs, and pelvic region. Another optional enhancement involves pressure points that influence pelvic circulation. There's a point on the inner ankle, about 4 finger widths above the ankle bone, traditionally associated with lower body blood flow. After the protocol, apply firm but comfortable pressure to this point for about 30 seconds on each side. You may feel a deep, spreading sensation. That's normal. There's also an area on the lower abdomen, a few finger widths below the navel, linked to pelvic circulation. Gently massaging this area with slow, circular motions for a minute can further support blood flow. Finally, body positioning can make a difference. While this protocol works while standing, doing the breathing portion lying on your back with your hips slightly elevated can help gravity assist blood flow to the pelvic region. For the muscle contractions, a reclined position can allow stronger engagement without balance demands. The movement portion generally works best standing, where you have more freedom of motion. You can adapt these positions based on what feels most comfortable for you. Before we wrap up, I want to quickly address something many of you ask me about, which natural supplements actually make a meaningful difference for men's health. After years of reviewing the research and working with men in practice, I've narrowed it down to 4 essentials: 1 to support circulation and erections, 1 for stamina and performance, 1 for healthy testosterone balance, and 1 for prostate comfort. They're all science-backed, designed to work together, and I've linked them below in the description and pinned comment for those who want to explore that option. And remember, this channel is a place where men support each other. If this video helped you, let me know your age and where you're watching from in the comments. It helps other men realize they're not alone in this. If men's health, confidence, and vitality matter to you, make sure you're subscribed. Here we focus on what actually works as the body changes. Your vascular health is trainable. Small, consistent actions can make a real difference over time. I'm Dr. Aria Brooks, and I'll see you in the next video.